I'm Caroline Chandler. I'm the Chief Clinical Officer for our Intellectual and Developmental Disability Services with Aspire Behavioral Health and Developmental Disabilities in Albany, Georgia. Intellectual and developmental disabilities is a medical condition that relates to the mental or the physical disabilities of people. It is generally diagnosed at birth and through childhood. However, it can be diagnosed up until the age of 22. About 2 to 3% of the U.S. population has been diagnosed with intellectual or developmental disabilities. That's roughly 1 in 5 non-Hispanic white people, or more prevalent in the African American community with 1 in 4 people. There's not a lot of research to this day that breaks out the African American population or even the Latina population. The intellectual and developmental disability population is disparaged as a whole and does not have equal access to health care in America. Research confirms that there's a stigma related to IDD diagnosis across the population as a whole. Only recently, I would say in the past 10 years, have I seen people and families becoming more open to communicate about their child's diagnosis and seeking help for them. It used to be that you would see people with an intellectual or developmental diagnosis, they maybe stayed home, they didn't get out in the community and do things that their peers would do. They went to school and they came home. And now you see people included in social media, in commercials, special post-secondary degrees, and really just celebrating the diversity of people and integrating into the community. So it's been great to see, regardless of race, as younger families develop and want to see their child included, regardless of their ability. In the 1970s, the term social determinants of health came into play, and that talked about the disparity among systemic race and looking at the poverty, gender, and socioeconomic levels of people and how they had access to care and resources. A lot of times the education level of families prevents them from knowing where to go for resources and how to access the help that they need. Again, based on poverty and having access to insurance, money for medication, things of that nature, along with their social circle. When a person has any disability, it's important to have support of friends, their faith-based community, co-workers, and a lot of times in poverty, we don't see that built into the community. Increased support for educational awareness in the communities is important, as well as wrapping around diversity, equity, and inclusion efforts. The more that we can celebrate people's abilities and focus on abilities rather than disabilities, we want to include people and fully integrate into our local communities. As families who have loved ones that may have a disability, as they will talk to their circle of influence and help erase the stigma from that, we can educate, we can celebrate, and we can advocate for changes that needed to be made to include everyone. And just have a richer community as a whole.